A live Kansas City Scout Cam look at Liberty right now. This is I-35 at 291 Highway near one of the wastewater testing sites where they test for the COVID virus. New numbers show this morning the viral load in the wastewater is either holding steady or dropping, but that wasn't the case earlier in the month. One place in the metro, we are seeing a 40% increase. So what does that all mean? We'll talk more about it coming up now on the Morning Medical Update. Good morning, everyone. It is finally Friday. It's April 15th. Thank you so much for joining us here on Facebook, on YouTube, and on Twitter. Last minute to get your taxes done. Today is normally the due date, but the government has extended the deadline to Monday. Coming up, the BA2 variant now showing up in one metro county. At 8:15, Dr. Hawkinson joins us with the COVID count and another COVID surge in the metro. What testing the wastewater is telling us right now. So get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links right there on your screen. First this morning in Johnson County, clusters of the COVID BA2 variant cases are being reported at daycares, schools, and in the workplace. The Johnson County Health Department reports 64 cases of BA2 per 1,000 people with a positivity rate of 6%. They believe that number is higher, but the results are not being reported due to people doing at-home testing. And the FDA has granted emergency use for this. It's the first COVID-19 breathalyzer. It's about the size of a piece of carry-on luggage, and you can get results in less than 3 minutes. The company says it was 90% effective in determining positive cases. The FDA still, of course, recommends getting a PCR test to confirm those results. Joining me this morning, our numbers gal is back, Dr. Amber Schmidtke, chair of the Division of Natural Sciences and Mathematics at the University of St. Mary. Also, Jeff Wenzel, with the Bureau of Environmental Epidemiology. I can't speak today on this Friday. He's with the Missouri Health Department. And Dr. Marc Johnson, so glad to have you with us. He leads the wastewater and COVID research for the University of Missouri. So glad to have all of you with us today. Gentlemen, good morning. All right, Dr. Schmidtke, let's start with you. So it's been a while since we've looked at those national trends. So I just want to help us kind of walk through what you're seeing and what you've been studying.
So cases remain really low for most of the country, but in the Northeast, we're starting to see a pretty dramatic increase in cases, in test positivity, et cetera. And they're starting to see an uptick in hospital admissions as well. As we know, COVID often doesn't stay in one place. So of course, we need to be vigilant during this time. And so, you know, it's a murky time for data. We have a situation where, as you pointed out, a lot of folks are not getting tested in a way that we can see. They're preferring those home-based tests that don't get reported to the state or to the federal government. And so we also have a challenge where, the government is no longer paying for free testing for the poor and uninsured. And so it's possible that we aren't seeing a complete picture right now. So that does complicate things.
Lots of new factors come into play right now. So let's talk about the numbers, though. When we talk about places like the Northeast, what we've seen in the past with the other variants, what that told you then and what it's going to tell us now about this variant.
So what we've seen with every case surge that's ever happened is that we see a rise in both case rate as well as test positivity. And test positivity is rising for the entire country right now, every region in the country. But we are only really seeing a case rise in the Northeast. So there's sort of this weird mix of the data right now. So we're in a place where we don't totally know what's going on, and that's why we often have to look at proxy data, things like wastewater surveillance testing, which is why it's really exciting to see the other guests who are here today.
Right, you say we don't always know what's going on. It's like, welcome to the pandemic, right? It's just, it's month to month, year to year at this point. Okay, so let's talk about hospitalizations. Walk us through that graphic as well.
Yeah, so the graph that I brought with me today, comes from the Department of Health and Human Services Community Profile Report, and it breaks it down by region of the country. And so, like I said, we're currently seeing flat COVID admissions in the hospitals. The one place where we are seeing an increase right now is the Northeast, which makes sense considering where the cases are at the moment. So we'll just have to kind of see. Hopefully this doesn't come to the Midwest. But I was telling you before we started the show, I've learned never to put COVID-19 in a box. We've been surprised multiple times about what it can do. And so I think it's important for all of us to be careful.
We like predictability, but not always going to be the case with this pandemic, that's for sure. Let's bring in Jeff Wenzel and Dr. Marc Johnson just to talk about the wastewater sampling work that's going on. What kind of data are you seeing? What are we gathering, and what is it telling us? Jeff, why don't you get us started?
So for the last 2 years, we've been collecting wastewater samples, looking for trends, increasing, decreasing trends. Those 100 locations represent about 50% of the population of Missouri. Over the last year, since February of last year, we've also been looking for the variants and unusual mutations in cases.
So talk about the process of collecting the samples. How is that done?
Usually it's a wastewater operator from a local facility that's collecting that. It's a 24-hour sample, so they're taking incremental samples over the 24-hour period until they get about a liter of water, and then that's shipped off to the University of Missouri Columbia, where Dr. Johnson's lab analyzes it.
Right, so there's a process. Dr. Johnson, jump in and tell us how helpful this collecting has been.
Yeah, sorry, I was a little distracted. They don't usually collect it with their hands. There's usually machines that do it. But it's been, especially with the variant lineage detection, it has been really phenomenal in giving us a heads up on really not what's coming, but what's here already, because patient data is always several weeks behind. One thing I can point out, we do all the sequencing in Missouri as well as for all of the sewer sheds from New York City. So one difference I can point out between the Northeast and here is there is a new sublineage of BA2 that is becoming very prevalent in the Northeast, which is BA2 12.1. It's 15% of patient sequences right now in New York, but it's, if it's 15% now, that means it's probably actually considerably higher because it's been steadily going up for the last 3 weeks. BA2 has been the dominant lineage in Missouri for weeks already. It's almost the only thing we're seeing. And there's been, so far at least, there's been no correlation between the prevalence of BA2 and the case numbers. Even though BA2 is taking over, the cases have been going down.
Dr. Schmidtke, how does this information help you determine your numbers and your data?
Well, like I was saying, the data are kind of murky right now. And so we do look at proxy data like this. And so the wastewater surveillance can give a helpful heads up. One challenge is, we're more than 2 years into the pandemic, and we really don't have a robust network of sampling sites across the country. There are states with no sampling that's happening. And for, Missouri, they're actually kind of a leader in this way because they have a very robust network of sites that they're able to test. Like they said, they're getting a good cross-section of the population to see what may be coming. And so it can kind of be the canary in the coal mine. Mm-hmm. What's nice about this is that you can see around some of these challenges that we have with testing because, this wastewater is looking at what's being shed in people's fecal material. And so it's not something that's going to fluctuate based on people seeking or avoiding testing. It's not something that, is an issue of data reporting and the delays in reporting that we're seeing. So it can be a very helpful tool.
All right, we're going to get to some community questions in just a moment. I want to turn to Dr. Hawkinson with our COVID count before we get to that. Good morning. How are you today?
Good.
Good.
Yeah, we have, most of this week we've had single digits. Right now we have 5 active infections, still that one person in the ICU and is on the ventilator. Again, usually for severely ill people in the ICU, we consider them in that active stage for about 20 days. So that could have an effect there. So 5 active infections, 28 additional in that recovery period, a total of 33. But overall, we are happy to see that our active infections are going down. And now that we're talking about cases, some areas cases are going up, some areas cases are still continuing to fall. We understand that not everybody is getting tested at those sites that report to the government. Some people may not even be testing. Some people may be doing home testing. We also have the concern that maybe it's hospitalizations going up. But I think the other thing that we have to remember here is it's not black and white. So we know that in the last stages, while we were testing everybody who came into the hospital, we would find some people who were asymptomatic. And during those last couple weeks, we had about a third to about 50% of our active infections that we considered, but they were totally asymptomatic. We found them on screening. So just the fact that hospitalizations are going up, we also have to understand that may be a misnomer as well. And so moving forward, I think through all of this, when we have population immunity with so many people being vaccinated and or infected, individual immunity if you are vaccinated and up to date. That is going to help make it more difficult as well to see exactly how many people are coming into the hospital exactly for COVID. Are there still hospitals that are testing everybody that comes into the hospital by screening PCR, even if they came in with, say, a broken leg, but they get screened and they're positive? So I think moving forward, it is going to be very difficult to tell what kind of capacity issues we're having, really what kind of the impact of surge on cases and hospitalizations are. But hopefully we'll get some better information and data and then present that to you.
A couple of questions from headlines this morning. The BA2 cases on the rise in Johnson County. I live in Johnson County. What kind of concerns are those when we see those increases?
I mean, I think we always have concern when we see increases, increasing cases. We know that with increasing cases, there is that potential for increase in hospitalizations, but typically hospitalizations for COVID itself, lag behind at least a week, 10 days, 12 days prior to after the cases start to surge. So it is obviously a concern. We know that there are no restrictions going on. We know that there are gatherings going on, and so there can be any time when you have lack of restrictions, no masking, people getting together. We saw this in Washington, D.C. We know there is the potential for that virus to spread to all of those people there in those spreading events. So it's a concern I think everybody needs to continue to take in that risk assessment, judge their health, judge their risk, be up to date with vaccination to protect you individually. But yeah, it's always a concern because we know the virus is circulating within our community. All right,
Pfizer says its booster shot strengthens the immune response for kids 5 to 11. What does that tell us about the timeline for kids under 5 getting the shot?
So that's a different issue. So 5 to 11, we know that they are saying now it can improve your immune function. We know that also with just vaccination, it's those 2 doses that people got, but instead, is it that spread apart that may be better? So we know that that booster is coming 4 to 6 months after. I think that is a good sign for those children 5 to 11. As far as what does it mean for children 5 and under, Peter Marks with the FDA was on a podcast recently and talked that they are continuing to analyze the data. And in his words, he hopes that there would be an approval before he goes on his next vacation. I don't know when that will be, sometime in the summer, but I think we are all hoping for approval for vaccination for children 5 and under fairly soon, maybe within the next few months. Again, they're still analyzing and collecting all that data.
All right, what are your thoughts on this breathalyzer? How does that work?
I think it's interesting. Anything we can do to help with diagnostics and early identification, because what is the key with early identification? It's getting treatment early, whether it's Paxlovid, Molnupiravir, Remdesivir, the monoclonal antibodies. So I think that's important. But there are caveats with that breathalyzer test. They do state that even if it's positive, because they are looking for chemicals that your body is going to be excreting, but they say if it's positive, that you should still follow up with a PCR test. But also, just like the antigen test, they say that you need to understand a negative result in the context of your own exposure history. Have you been around people? Were you at a large gathering? And so take that into consideration as well. At that point, you may also need to continue to get a PCR test as a negative proof that you don't have it. So there are caveats with this test, but it's one more thing that we can help use to identify early and hopefully get treatment early.
Similar like the home test, you have to have that PCR.
I think so.
There's no escaping the brain poke, right?
They still believe that the PCR continues to be the gold standard. You're exactly right. Yep.
All right. We've been talking about the Northeast. Let's take a live look at New York. Are we going to Times Square this morning? Can we head out there? All right, live look there in Times Square this morning. We've been hearing that Broadway, several performances have been canceled last week. Actor Matthew Broderick contracted the new variant, and others are playing with understudies and major roles, kind of as a safety precaution. Just another sign COVID is still here, and it is still interrupting life as we know it. Dr. Amber Schmidtke, with the early numbers that we're seeing, will this impact employers here in the metro like this, where we see it interrupting life? We know COVID's there, but I think people have kind of turned the other cheek when it comes to it as we well know. But do you think we could see that?
Anything's possible with this virus. And we have seen that a lot of people have kind of started to move on and get some of that normal life back. And I know that that has been wonderful in many ways. The thing about the virus is it's not quite out of our lives yet. And so we have some decisions to make about how much we try to control the virus as compared to letting it control us. The reality is that if you have a lot of people out sick, your business may be closing temporarily just because you don't have enough staff. And so the question is, how do we control that chaos to the extent that we can? So I wouldn't be surprised if we see something like that again in the future. I don't think by any means that the pandemic is over. We know that we tend to see seasons with this virus. And so, we may still have some challenges. But the good news is we're heading into a time of year where it's warm enough outside that people may be more likely to gather outdoors, and that will always help. Or they may be more likely to open windows, et cetera.
Your thoughts on the breathalyzer, just another tool out there to help people get tested and possibly...
Yeah, like Dr. Hawkinson said, I think it's really important to have as many testing entry points as we possibly can, because with a lot of those treatments, it's really important that you start that treatment right away and in order to get the most benefit. And when we have the challenges that we do right now with testing centers closing or people that are uninsured having more difficulty accessing a test, making those tests readily available and fast is going to be really important.
Couple questions we've got, and I'm going to bring in Jeff and Dr. Johnson as well. Isaac has a question, and it may have been answered earlier, but he wants to ask this again. If the virus isn't thought to spread through the water, then how is wastewater a reliable means of detection? Any thoughts on that?
It's still a valuable indicator. It just so happens that once the virus spreads through the wastewater, it becomes inactivated. It is no longer infectious, but it is a very meaningful and accurate reflection of what's going on with cases in the community.
All right, thank you for clarifying that. Question about what else can be detected through the wastewater? What other things are you looking for?
Just about anything. Other viruses, small molecules. You can detect opioids, drugs, you name it. We often never guess. So we often need an indicator of whether the sewage has been diluted or not. Guess what our best indicator is from a population, a small molecule that I bet you've consumed today?
What's that?
Caffeine.
Oh, yes.
You can
Lots
measure,
of that
you can
floating
measure
around.
the caffeine and get it pretty good. So if the caffeine levels are down, probably there was a lot of rain that got into your wastewater and it's been diluted. It's one of the more accurate indicators we found.
How interesting.
That is super interesting.
That's super interesting. Okay, question from Pamela. Does the vaccine and booster work with the new variants? I heard they're ineffective with the new strains. Dr. Hawkinson, any insight on that?
Yeah, I don't think that's true at all. So they are variants. Certainly there is no other strain of SARS-CoV-2, so we should clarify that. But right now what we have seen through clinical and laboratory data is that the original mRNA vaccines and the Johnson & Johnson vaccine, the vaccines that we currently have, when you are up to date with your vaccines, they do produce immune responses to all of the variants that we've identified. So they do produce antibodies. They also continue to protect, probably mostly through T-cell immunity. They continue to protect you from hospitalization, severe disease, and death.
All right. Kathy says she plans to get her 4th shot next week, 66 years old with autoimmune diseases. I want to participate in an event, a choir event, and then another one in the summer. Are the odds in my favor once she gets that shot? Considering her age, you know how people just want you to tell them how to live their life.
I know.
They want to hear it from you that it's okay.
She obviously has insight and has assessed her risk and understands what her comorbidities may be. Obviously, age is a big one. Autoimmune disease, that is important. What we have also found is that for probably about 90 days after your dose, you do even have fairly good protection against infection itself. And so I think that is important to note. That protection against infection does wane, but you do still have considerable protection against hospitalization, severe disease, and death, at least for 6 months and probably more. Again, given your age and your comorbidities that you have talked about. So you should be fairly safe. But again, anytime you do get that infection, you just have to be aware. That's why it would be important, as we talked about with this breath test. If you do think you have been in a high-risk exposure situation, you do develop symptoms, please go get tested early. Talk with your doctors, and if you need to get on either remdesivir or monoclonal antibody or Paxlovid or molnupiravir, it's a good idea to get started as early as possible.
Well, and it sounds like people really are taking the advice you've said all along. They're starting to list out all of the things that may be a factor and then make that decision. Yeah. Good advice. All right, let me see. I've got another question. Well, I want to ask our guests, Jeff and Dr. Johnson, kind of walk us through, Jeff, just kind of how COVID has impacted the work that you do over the last 2 years. Kind of take us through kind of a quick timeline when this pandemic hit, the work you've been doing, and the work you still continue to do.
Well, sewer shed monitoring had never been done in Missouri and really most of the United States. So starting around this time 2 years ago, we ramped up sewer shed testing to see if it would be beneficial in telling us something about this outbreak and disease. And been growing and expanding ever since.
Dr. Johnson, COVID impact on your work.
It has changed it entirely. I used to study HIV. Now all I do is study poop. It's been a giant change.
Well, I'm sorry to ask you this, but could you give us further details about that? We appreciate your shift in what you study, but explain that a little bit more for people.
You mean the process of doing the analysis?
Yeah.
Well, it's not as bad as it seems. It comes in little tubes about yay big. About a quarter cup is what it takes for us to do the analysis. And it's not as bad as you think. We first filter it to get rid of all of the solids, and then we extract the RNA from that. And the RNA is the material that's inside the virus that contains the information about which variant it is. And that's what you use for both quantifying how much virus is present and also for sequencing to figure out which of the variants is in that community.
Tell us a little bit of the work you do with HIV.
I have to think back. No, I mostly studied how the virus and the host interacted, and towards the end had some drug development process that I was working on to see if we could help clear virus from the cell, from the body. Seems like that's forever ago. That was a whole pandemic ago.
Right, I know. Well, we talk about it. I mean, Dr. Hawkinson works with HIV patients, and we've got World AIDS Day coming up next week, I believe. So it's always a topic that we're always interested in. So thank you for your work with that as well. Joe Ellen has a question. What about safety returning to the gym? Dr. Hawkinson, help us. I need to get back into exercise, something you tell people, don't skip out on exercise. That keeps us healthy. But she's over 70, but she has had her fourth shot, and she does wear a mask. So equate that for us.
Yeah. I think that can be fairly safe. If you can also find times when the gym may not be as busy, that's good as well. I think it is difficult to do some exercises with a mask, like running on a treadmill, so you have to take that into account. But I think you should be able to go ahead and do that. And of course, now it should be fairly nice where you can also walk outside. But I think going to gym, assessing all of those risks, I think you're as safe as you possibly can be. Again, you can lower that risk by also going at less busy times. I would probably avoid those classes where people are getting together in those rooms and breathing pretty profusely, expelling droplets and virus into the air should they be infected. But I think you can go and do weights and work out with a trainer. I think you can do that safely, especially with a mask. Yeah.
Doc Hawk, Isaac has your thoughts on this, but in the future, how we have breathalyzers for booze. What do you think about bouncers using the COVID breathalyzer at the door to find out if you're infected?
Yeah, I think if the sensitivity and specificity is there, I think that's reasonable. But we also have to understand, I don't know how long those volatile compounds would be abnormal or detected. Because we know that you can detect PCR positivity even up to 90 days after having the infection. So does that mean you can't go into a bar for 90 days, depending on how long those chemicals that breathalyzer detects are still able to be detected. Is it just when you're in that active viral replication, or does that continue? So I think that would be an interesting thing rather than some vaccine passports or vaccine cards. That's one more thing that you could use. It's a good thought, but we just have to wait and see if all of those questions that I asked about that, certainly that would cause, and if it were helpful, maybe a reasonable thing, but I don't foresee that in the future.
Dr. Schmidtke, Kansas and Missouri kind of have moved into the endemic phase of the pandemic. No masking, less testing. How do we combat that?
Well, first I want to say that endemic does not mean the end of the pandemic, and I think that that's a misnomer because of the root term. What that means is that there is a low level of disease that is below what's called the epidemic threshold. We should be aware that case rate can spike above that epidemic threshold at any time. And so that's why it's important to continue to have good data collection so that we know what's coming and so that we can adjust our protection strategies as needed.
So can we show this graph that kind of intertwines, that kind of where it meets with the disease, public health, and human behavior? Because I guess we talk about breathalyzers at the doors of bars. We talk about what people are just going to get back to doing. So how does this all intersect?
So yeah, public health, I love the public health because what it really is an intersection between things like infectious disease in this case and social behavior. So we really are, it's important about messaging and what are people doing. And so the graph that we're showing here is sort of a timeline so that you can sense, like, from the day that a person is exposed, about how many days does it take for them to start developing symptoms, and maybe they seek a test right away, maybe they don't. On average, it takes about it could take up to 4 to 5 days after the onset of symptoms for a person to seek a test. So that helps us to understand why we've been sort of always a little bit behind the trend with the data that we have, which again is another reason why the surveillance testing that the other guests on the panel today, the work that they're doing can be really, really important because it helps us to see around the fog of that delay due to social behaviors, test-seeking behaviors, that sort of stuff.
So you had mentioned there's multiple layers to making this spread slow, possibly stop. Can you demonstrate that through one of your graphs? Do you have one of those?
Yeah, I brought I don't know if they have it, but the Swiss cheese picture.
Oh, yes. We love our Swiss cheese model.
I mean, this is an oldie but a goodie. We've been talking about this since the beginning of the pandemic. And it's just the idea that, we don't have a single bulletproof strategy against COVID-19. And so that's why it's important to, and in that sense with this graphic, because none of them are bulletproof, you can think of them like a slice of Swiss cheese with the holes in them. And if you were to breathe through a slice of Swiss cheese, obviously some air is going to get from one side to the other because of those holes. But the more of those strategies that we layer together, the more stacks or slices of Swiss cheese that we stack together, the more likely we are to cover enough of those holes that we do get that protection. And so it's a mix of shared responsibilities between individuals and communities.
Dr. Schmidtke, now that is one of your graphs I can totally read and understand. Okay, so you're our numbers person, but you break it down with Swiss cheese. I'm totally on board. I get it. Okay, quick question. Well, do we have any reporters on the line? No reporters. Okay, I'm going to get Dr. Hawkinson to Maggie's question. I've had the shot for immune compromised. Do I get a booster after 6 months? I'm 81. Mm-hmm. Thank you for all you do, by the way.
Yeah.
So she's had the shot, 81,
yeah.
Immune compromised. Does she need another one?
Yeah, I mean, if you're telling me immune compromised, that does put my mind and you into a different category. So certainly we know that there is that recommendation for that 5th dose if you're immune compromised. Remember, if you do have immune compromise, which is a broad spectrum, and you need to speak with your physician about that, but it's pretty broad. So it's basically 3 primary doses, and then it's that first booster, and then it's that second booster, which would be a total of 5. So if you've received 4 and it's been over 6 months, I think it would be a good idea. I'm certainly a proponent, especially because of your age alone, that you would go ahead and get that additional booster. So that would be a 5th dose, if that's what you're asking. Yeah.
Last question is from Joyce, and it's for Dr. Schmidtke. Do you think there is sufficient information now to accurately track COVID infections?
Wow. Well, we know that we've been undercounting COVID cases for a very long time. So it's one of those things that I think that public health is doing the very best that they can with the data streams that they have. In the end, there's a lot of diseases where we undercount disease, diarrheal illnesses being a big one, because a lot of people will shrug that off and take care of it at home. It's self-limiting, and they never do seek treatment. And so those are cases that go unreported every year. And so with the same sort of thing is going to exist here. I can understand and appreciate what I think may be some frustration that may be coming in with that question, the sense that, well, what is going on? And it does feel like nobody seems to know, right? But we do try to make the best estimate of the situation with the data that we have. And right now, what it tells us is that, at least in the metro for now, things seem to be okay. But we are seeing some warning signs in other parts of the country.
So glad you got to come on today alongside with Dr. Johnson and Jeff today. So it really helped kind of put the big picture of what you do into perspective. Gentlemen, thank you so much for being with us. Jeff, I want to start with you and just get your final thoughts. Just anything that I haven't asked you that you want everyone to know about.
Statewide, looking at all of our locations, we're the lowest viral load total that we've been in since we've been monitoring.
Dr. Johnson, your final thoughts for us today. Oh, on mute.
Sorry.
There you go.
Sorry, like Jeff said, things are looking good. If they start changing, you'll hear from us.
Okay, we're going to get you back on. Thank you so much. We appreciate all your information and all that you do for us. Thank you very much. Dr. Schmidtke, again, great to see you. Final thoughts for us today.
Yeah, I was just going to share the story. I got to meet a coworker's brand new baby about a week ago, and I think it's important to remember that, like Dr. Hawkinson was saying, we have a lot of tools on the treatment side, but we have a lot of tools on the prevention side too. When I went to see that baby, I made sure to do one of those rapid antigen tests at home prior to even getting in the car, because the very last thing I want to do is give COVID-19 to a newborn. So anyway, I just wanted to share that. We still have some really easy things that we can do to keep each other safe.
Such a great reminder, because it's about, again, thinking of other people, thinking of you. But if you don't think of you, at least think of other people and their newborn babies. Dr. Hawkinson, final thoughts from you today.
Yeah, I'll certainly echo Dr. Schmidtke's comments, and just, hopefully it'll be a nice Easter weekend and people can get out and be active. If you want to go to the gym, go to the gym. Again, assess your risk and protect yourself as much as possible, but continue to be active and keep moving and be healthy.
All right, we're talking Mother's Day. Dr. Schmidtke, what do you guys do for Mother's Day? It's coming up in about a month. What do you get? Do you get pampered, spoiled from the kiddos?
I'd like to think so. But at University of St. Mary, that is our graduation weekend. So I'll be celebrating Mother's Day with all the other graduating seniors' mothers too.
And all those proud moms out there, for
That's
sure.
That's right.
All right, so we want to know kind of what you want and what you plan on doing for Mother's Day. There's a QR code right there on your screen, and you can email us at the Medical News Network there on your screen as well. Just let us know your ideas. Let us know what you want. And we found out what some moms want by hitting the streets here inside the health system. Here's what they had to say.
Definitely a card and take her out to dinner.
Fruit, lotions, and perfume.
Usually for Mother's Day, I just like to hang out with my son. Just have a day where we usually go out to the park or something, and we just have like a day we spend together. It's really not a big thing. I don't really do gifts for Mother's Day. Just quality time.
I would love a Coach purse. Yes, for Mother's Day. I would really love that.
So for Mother's Day, I celebrate my great-grandma because she is the one who raised me my entire life. So I get her flowers every year, some roses and some daisies. So she likes flowers, and that's what I like to get her.
Oh, that's a good boy right there. That's a good boy. And look at that mom just straight up asking for the Coach purse.
You like a woman who knows what
I guess so. Exactly. All right. I like bacon and peace and quiet. So hopefully that's on the menu for me this Mother's Day. Thank you all so much for being with us. Don't forget you can catch our shows anytime on Facebook, on YouTube, and on Twitter. And as we leave you today, we want to share some good news with you. We are so proud to announce that the Royals have, again, chosen the University of Kansas Health System to be their official healthcare provider for the next 4 years. The University of Kansas Health System's president and CEO, Bob Page, and Royals president, Dayton Moore, discuss what makes this partnership unique. Have a great weekend.
The Royals are proud to partner with the University of Kansas Health System for the 12th consecutive year. We have seen how they provide the best care for our athletes, but also all of Kansas City. Our partnership has helped us win championships in the past, and we're looking forward to winning more in the future.
The University of Kansas Health System is consistently ranked among the best health systems in the country. We are committed to providing world-class care to the Royals organization and its family members. And we're equally committed to providing that same level of care to the Royals fans. We're excited about another great season of Royals baseball. Go Royals!
Coming up Monday on the Morning Medical Update. No masks required, just as spring and summer travel arrive. We know COVID is still here, but what else poses a threat? Protecting yourself on planes, trains, and automobiles. That's Monday at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.